pleasant day to all of you. Today, we will be discussing our research topic about promoting water sanitation and hygiene to indigenous people of Bangkal, Abucay, Bataan. Together with my cohorts, Shara Laksamana, Abigail Talurin, Raister Vasquez, Eliza Mercado, and yours truly, Sean Martin Villasor. Chapter 1. Background of the study. Statement of the problem. Objectives of the study. Significance of the study. And conceptual framework. Chapter 2. Review of related literature.
Now, it is fair enough to wonder why we have chosen this particular to deal with, and here is the answer. Background of the study. Bangkal, Abucay, Bataan, with a total island of 79.72 square meter, consists of 59.38% of population are ETAs. Based on 2015 census that I gathered, in 2015 there are 115 households, in 2017 there are 132 households, in 2018 there are 150 households, in 2020 there are 182 households. As we can see, the growth population of ETAs is increasing year by year. According to UNICEF, 4.5 billion people who do not have own toilets at home, 39% of the global population still practicing open defecation, and 30% of the global population do not have proper hygiene. The Magbuon tribe is still included in the percentage of UNICEF. They usually have storage tanks to fill every time they fetch water from spring. We cannot assure how many times they clean their tanks. A complicated statement confused if not better.
A poor water supply and doing opendification most happens in waterways and rivers. It impacts health by causing acute infectious disease and malnutrition in children. They begin to lose a lot of fluids and lack of appetite for food. Sometimes intestinal worms attacks. This because lack of proper sanitation and hygiene. And opendification can also threat to women's privacy and dignity.
Objectives of the study. We are aiming to give information about how important WaSH in individual and community of Bangkal. From what discussed earlier that people in Bangkal has a water supply from the spring, from the data collected, majority in the community of Bangkal do not have direct access of water. People of Bangkal, despite their general understanding about their environmental and health impacts, some households still practice open defecation and irresponsible disposal of solid and liquid waste, which negatively influences their neighborhoods. If the municipal and local governments are convinced of the negative influences of our study, they may be prepared to introduce new bylaws as well as implementing effective enforcement strategies that could prevent such practices. This initiative will contribute to the goal of improving environmental safety and health in Bangkal. We aim to teach right way of washing hands, teach how important having good hygiene and sanitation, disseminate information about the open defecation is a health risk and all the diseases that they will get with this. Good personal hygiene is one of the best ways to protect yourself from getting illnesses. Washing your hands with soap removes germs that can make you ill. Maintaining good personal hygiene will also help prevent you from spreading diseases to other people.
Significance of the study. To the public. To help the community to understand that health is important, and be aware to prevent diseases. To the faculty, to educate the students about good hygiene. To the parents, to give an example and give practices for the students. To the students, to improve health of oneself. To the researchers, this research can be a reference or basis of related studies of other researchers in the future.
Conceptual framework. 1. Understand the problem. Upon applying water sanitation and hygiene program for the indigenous people of Bangkal Abucay, we assess first what are the problems and challenges we should get working on with the solution, considering the factors such as demographic area, social culture and norms, economical status, and information and data that is gathered, putting it in a systemized statement. Number 2, make possible solutions. Second, after assessing the problem of the collected information and how it affects or hinders the WaSH program, make effective solutions that are feasible and attainable from the resources that can be provided. Number 3, deliver solution. Designed solution will be tested in actual, focusing on the experience, meeting difficulties and failures throughout the process. We can be able to make adjustments of the strategies, programs, and facilities. Thus, delivering solution would lead the study in giving the most efficient program and strategies. Number 4, monitor and move forward. Lastly, observation of how activities and programs are taking place and what improvements will be applied. Consistency is the most crucial part of the program in order to meet a successful outcome. Chapter 2, Review of related literature. Other studies. To give sanitation service of basic water. Understanding of health risk and importance of sanitation service. To give WaSH program to the people in rural areas, especially for women. To prove conclusively the effectiveness of using soap and water. To access safely managed drinking water and sanitation services and basic hygiene. Our study. We are giving an easy transformation on giving information in importance of sanitation by teaching them the importance of using soap and water in sanitation service as basic hygiene that can be the cause of health risk regarding in development policies with unfulfilled water supply. Sanitation and hygiene deals with WaSH service in Bangkal, Abucay. Research gap. Practice of open defecation are still present in their area. Because of the social culture and norms, inavailability of latrines in each household due to economical status, indigenous people in Bangkal still practice open defecation. Number 2, there are almost 70% of individuals in Bangkal that are still lack of knowledge about what is safe and unsafe to drink. 70% of indigenous people of Bangkal believe that the source of water is safe to drink without knowing if the water source is tested to be potable and that the risk of contamination is still present with poor sanitation of their containers. Number 3, children of the tribe are lacking practice of hand washing. Children didn't know the importance of hand washing. They sometimes forget to wash hands in entire day. To express our views in a clearer manner, we created this visual representation. We believe that it takes all this to improve water sanitation and hygiene in Bangkal, Abucay. Thank you.